High-risk donors. There is a classification of donors that is worth your time to consider in advance. You may be presented a consent to sign for allowing us to approach you with what is called a high-risk donor offer. Your signature on this consent does not commit you to receiving any high-risk donor we accept on your part. It just allows us to approach you about them. We encourage you to read through this consent form carefully and call with any and all questions. The Centers for Disease Control have determined that there are certain behaviors that put people at risk for contracting infections from other persons. Since the donors are unable to communicate with us, the information we receive comes from their family. The family may or may not be aware of some information. For that reason, we consider every donor potentially a high-risk donor. The categories of high-risk behaviors are outlined on the informed consent, and they are things like injecting IV drugs, having sex for drugs or money, or being incarcerated for more than 72 hours within the past 12 months. If the donor engaged in any of these risky behaviors, they will be classified as a high-risk donor. This is not something that is specific to UCSF. If we consider a donor like this for you, we will typically call you in advance to let you know the category of risky behavior that the donor engaged in. We cannot give you specifics, just like we cannot give you the donor's age or sex or cause of death. This ensures some privacy for the grieving family. Here's what you should know about these high-risk donors. Some of them are very good donors, and before we would call you with an offer, our surgeon has gone through all of the other information and felt it is a good offer for you. But we must inform you about the risky behavior. The surgeon has reviewed the size match for you, the imaging, the function of the lungs, and the blood work. We typically will not offer a donor to you that has positive testing for viruses like hepatitis B, hepatitis C, or HIV. This testing has been completed, reviewed, and is negative. So the increased risk is that the donor may not yet have reached threshold where the blood testing is positive by our current techniques, although the window is small for this. To ensure that we monitor you for your safety, your blood will be tested for these transmissible diseases when you are first admitted to the hospital, then tested again in about 2 to 3 months after surgery, and tested again about 10 months to a year after surgery. This way, if you develop the virus, we will know about it right away and get you started on treatment. The other thing you should know is that these diseases now have very effective treatments, and we will monitor you closely. The risk of contracting one of these infections from a standard donor who has not engaged in any of these risky behaviors is about 1 in 20,000. While the risk for contracting an infection in a high-risk donor is greater than this, it's still quite low. For all of these high-risk categories, the risk of developing an infection is still less than 0.5%. The main thing to know about these high-risk donors is that we will not call to offer you a donor that we do not think is a good one. We want your transplant to be a success almost as much as you do. Be assured that we screen out many donor offers for reasons of quality, size, nodules, etc., and you never hear about them. If we are calling you for an offer, it is likely a good one.